Okay, well, good morning, everyone, and welcome to the National Telehealth Conference. And in particular, I wanted to welcome everybody to this session on improving access to telehealth and broadband services. We're very lucky to have a true all-star panel for you this morning to discuss what the federal government is doing around both expanding internet access for all Americans, but also what we're all doing to play a role in expanding telehealth as part of that. My name is Brendan Carr. I'm one of the four, although I have to check, we're getting a fifth commissioner kind of any day now, but I'm currently one of the four commissioners at the FCC. And for those of you that don't know, the FCC has an important role here. In particular, we're charged under the Communications Act with expanding high-speed internet access across the country. And we do that through a variety of different programs. We have a $10 billion a year universal service program that we use to both subsidize internet builds in rural areas, but also to subsidize connections to brick and mortar healthcare facilities. We play a wide-ranging role beyond that as well in terms of facilitating access to high-speed connections. And in my time on this job, I've tried to spend as much time outside of Washington, D.C. as possible. And one of the things that's truly stood out to me is the visits I've had a chance to do with healthcare facilities across the country. You know, we played a big role, as I said, at the FCC of connecting high-speed connections to brick and mortar healthcare facilities, and we've seen some good benefits with that. But one of the things that I saw on the road was this new trend, I guess new a couple of years ago, towards connected care. And I learned about this on a road trip to Ruleville, Mississippi, where I visited a very small rural clinic in North Sunflower County. And I met a woman there named Miss Annie, and she had noticed the first signs of diabetes when she woke up one morning with blurred vision. And she wasn't seeing much progress in a traditional healthcare setting. So she was sent home with an innovative pilot program that gave her a iPad, a Bluetooth connected blood glucose monitor, and she would be home every day, prick her finger, enter it into the machine, and she would get instant feedback about, what to eat that day, how to exercise, what to do. And she saw remarkable improvement. And at least at the FCC, we looked at that and saw how can we build on that. So in addition to brick and mortar connections, can we also have connections directly to the patient in their home? And we thought about this sort of like the transition from Blockbuster video to Netflix, where now with a high-speed connection with digital technologies, you can get care right there in your home. And it's oftentimes better. It's not just replicating what you get in home because it's constant monitoring. We see better adherence, obviously fewer patient cancellations because transportation is not an issue. Childcare is not an issue. We saw other sort of knock-on benefits as well in mental health, where you're treating kids sometimes, and they're more comfortable in their home setting. And oftentimes you can get a little glimpse about that home environment just by, what's in sort of the back of the screen. And then telehealth obviously just took off during the pandemic. Some of the data that we've seen shows that during the acute phase of the pandemic, in-person visits for mental health in particular dropped by almost 40%. And that's from sort of a low in the country in the sense that we need to increase people's willingness and ability to access mental health. So a huge drop. But luckily, we saw at that same point in time a over 1,000% increase in telehealth visits at that same point in time. And some of this has started to level off, but we've gotten to the post-acute phase of the pandemic. We've seen telehealth visits stabilize around 10 times the pre-pandemic level. And so again, the data that we're seeing is just quite remarkable. The savings for the healthcare system, the improvements in outcome. And so I think this is a great panel to sort of each section of telehealth internet access, because if we don't have high-speed internet access, a lot of this opportunity is simply going to be unavailable, particularly in rural and frontier and remote parts of the country where it's already difficult to get in-person visits. So we know high-speed internet is a necessity, and nowhere perhaps that more important than telehealth. And I can assure you that we at the FCC are committed to ensuring that everyone has reliable high-speed internet. And right now, as we'll get into in the panel, we have a unique opportunity because we have a significant amount of federal funding to make sure that we finish the work of bridging the digital divide, because we're not there quite yet. And so with that, I'm happy to welcome the panelists here, and then I'll turn it over to them to do a more detailed introduction of themselves and kick off the discussion. We'll also be doing a Q&A. Hopefully we'll have time for that, so feel free to send your questions into the queue for that, and we'll look at that. So I'm happy to welcome my colleague, Brian Boyle, who is also here from the FCC. We also have Mark Colin from what we refer to as NTIA, the National Telecom and Information Administration. They're playing a really big role right now in coordinating the infrastructure spending that the administration is rolling out. So a lot on their plate. Look forward to hearing from them about that. And then Kelly Kubena from the U.S. Department of Agriculture. And ag also plays a big role in connectivity. I mean, it's maybe not something that most people know about, but the different programs that they have go a long way in making sure we have connectivity. And as Congress takes up the Farm Bill soon enough, I'm sure there'll be even more discussions about agriculture and broadband funding and broadband initiatives. So once again, after we hear from all the panelists, we will have time for some Q&A. So please feel free to share your questions in the chat there. And with that, I will turn it over to our first panelist, Brian, for a little bit more about you and your opening presentation. Look forward to it.
Thank you very much. It is fantastic to be here with all of you today. As Commissioner Carr said, I'm Brian Boyle. I'm a Deputy Division Chief here at the FCC in the Telehealth Policy Division, which is the division that manages all of our universal service programs. And I'm going to talk about some of the things we at the FCC do to promote broadband. I'm going to talk about a few programs that we have. First, we'll start off with the Rural Healthcare Program, and then I'll also discuss a program called the Connected Care Pilot Program, the COVID-19 Telehealth Program, and then finish with one program that is not telehealth specific, but that could be a valuable resource for connecting low-income patients for purposes of telehealth. So first, the Rural Healthcare Program. This is an over 20-year-old program that really focuses on providing connectivity to brick and mortar healthcare providers. There are two subcomponents to the program. There is the telecommunications program and the Healthcare Connect Fund. I'll provide a little bit of information about both of those programs, but just some overall information about the RHC program. The cap for funding year 2023 was $682 million. The program does operate on a funding year cycle from July 1st through June 30th. Applications are required to be filed in advance of the funding year. The deadline is normally April 1st, and there's a required competitive bidding period before applications can be filed. So now would be a really fantastic time for anyone who is interested in participating in the Rural Healthcare Program next year to become familiar and start that process. Eligibility wise, the program is limited to certain healthcare provider types, such as rural health clinics, not-for-profit hospitals, local health department agencies. In addition, participants must be nonprofit, or with one limited exception that I'll get into, they must be rural. So general overview of the telecom program, the two components of the Rural Healthcare Program. This program is designed to put rural healthcare providers on the same footing as their counterparts in urban areas. So the way it works is that healthcare providers pay what we call the urban rate, which is essentially what a healthcare provider in a city within that state would pay. And then the Universal Service Program pays the difference between that urban rate and the rural rate that the rural healthcare provider actually pays. This is a program that oftentimes very rural healthcare providers participate in the way that they can connect for purposes of telehealth. One other aspect of this program is that healthcare providers can only participate as individuals, so they can't be members of a consortium. So a little bit on the Healthcare Connect Fund program. That program operates a little bit differently. Rather than focusing on that urban-rural differential, the Healthcare Connect Fund program provides a flat 65% discount on eligible charges for broadband. In this program, consortia are permitted, so oftentimes we see groups of healthcare providers banding together to apply for the program together, and that often offers bulk purchasing discounts and also administrative benefits. Additionally, some services such as infrastructure like equipment are eligible in the Healthcare Connect Fund program, but aren't in the telecom program. And then finally, I mentioned this exception to the rurality requirement in the Healthcare Connect Fund program. Non-rural healthcare providers are able to participate in the program, but only if they are part of a consortium that is majority rural. So we've seen a few changes to the program over the past couple of years. Earlier this year, with Commissioner Carr's support, the commission made some changes to improve the program. We're always looking for ways to make our programs operate more smoothly and more efficiently. One of those was revamping the way that we calculate support in the telecom program. I mentioned this urban rate and rural rate in the telecom program. There had been a rule in place that required a few years ago that established a database for determining what that urban and rural rate would be, which determined the level of support. After that launched, healthcare providers and service providers raised some concerns about the outputs there. So the commission looked at that, waived the requirement to use the rates database for a few years, and ultimately earlier this year reached the conclusion that it would be better previous method for determining support in the program. So that was one step the commission took to improve the program. The other one was a change to the invoice process in the telecom program. The Healthcare Connect Fund program invoice process operates rather smoothly. So the commission adopted many aspects of that for the telecom program. And then finally, the commission made a change to the way that support is determined when we reach the cap. There previously had been a requirement that a subcap in the Healthcare Connect Fund program apply all of the time. The commission changed that and determined that that should only apply when the overall program cap is reached. So in his introductory comments, Commissioner Carr mentioned the fact that previously there had been a focus on brick and mortar facilities, and that he and others at the commission a few years ago, even before the pandemic, realized that there is more that we at the commission can do to meet telehealth needs, because telehealth often exists outside of brick and mortar facilities. And the commission launched the Connected Care pilot program to shortly after the pandemic began, but again, it had been in the works for some time before then. So first, what is connected care? Commission defined telehealth that uses broadband internet access service enabled technologies to deliver remote medical, diagnostic, patient-centered, and treatment-related services directly to patients outside of traditional brick and mortar facilities. So the Connected Care program provides those services. It has a budget of $100 million over the 3-year duration of the program. It has an emphasis on treatment for low-income and veteran patients. Now, with this particular program, all selections have already been made. Those healthcare providers that were selected to participate in the program are well underway with their pilot projects that will last for 3 years. After those projects are complete, the commission will issue a report on the findings, and the projects are expected to be complete in 2025. So when the commission evaluates the efficacy of the program, it's going to look for a few things. It's going to look for how the program did, or how the commission in the future can improve healthcare outcomes through connected care. It's going to look for reduction in costs, and also how the commission can support the trend toward connected care everywhere. So certainly more to come there, and I'll discuss some preliminary findings from the Connected Care pilot program after I discuss the COVID-19 telehealth program, which, as the name suggests, was specifically targeted to help healthcare providers connect consisted of 2 rounds. The first was in 2020, and that round appropriated $200 million for 539. That round is complete. There was a second round in 2021 that made commitments for 446 healthcare providers, and that totaled $256 million. So because of the end of the national declaration, emergency declaration, no more purchases in the COVID-19 telehealth program can be made. However, we're still in the invoice process for the wind down. We're winding down the program and are still in the invoice process. The deadline for submitting invoices will be October 31st, 2023. So if you are one of those few healthcare providers that has an award in the COVID-19 telehealth program, but has not yet submitted invoices for that, please do that soon. There is no need to wait until October 31st to submit those invoices. If you have any questions about the reimbursement process, you can see my email address on that screen. Please reach out to me and we will answer any questions that you have about that process. COVID-19 telehealth program, the Commission will also release a report with some findings, but the Commission did, the Wireline Competition Bureau, which is a component of the Commission, issued a preliminary report earlier this year that analyzed what we had learned from these programs thus far. And really, when we plan these programs, we know that the experts are healthcare providers throughout the country, so we need to receive input from them to determine how we can help with providing access to telehealth and particularly broadband for the purposes of telehealth. So we found a few things thus far from those programs. One is that the COVID-19 telehealth program facilitated the continuity of care during the pandemic. We had several healthcare providers report that to us. For example, Asian Pacific Healthcare in Los Angeles saw a significant increase in telehealth visits in March 2020. The very beginning of the pandemic, 36% of its visits were via telehealth. By January 2021, that number was 86%. Additionally, we found that patient experience improved with increased access to telehealth. Barnes Jewish Hospital in St. Louis found that the additional access to telehealth decreased the potential exposure to the coronavirus and also reduced travel time for all of its patients. And one other very important point is that, and we did not coordinate this with Commissioner Carr, but in his opening remarks, he mentioned that telehealth is fantastic for remote patient monitoring and behavioral health. That's what we found in this report as well. Just a couple examples of that. Faith Regional Health Service in Norfolk, Nebraska found that remote patient monitoring reduced inpatient visits and also allowed for monitoring for patients who could not tolerate office visits. Access Community Health Centers in Richmond, Texas found that telehealth was particularly helpful for behavioral health. So Commission will certainly have more findings on the COVID-19 telehealth program and the Connected Care program in the coming months and years. But that is what we have found thus far. Then I did want to mention one other program that is not telehealth specific, but can be a really, really helpful tool for connecting patients. That's the Affordable Connectivity Program. This program is a result of the bipartisan infrastructure law from 2021, and it is geared toward connecting low-income households by providing a discount off of their monthly broadband service. To qualify, a consumer would need to either participate in certain federal programs such as SNAP or Medicaid, or have an income at or below 200% of the federal poverty guidelines. Program works like this. It provides a discount of up to $30 per month for broadband service or $75 per month for households on qualifying tribal lands. In addition, there is a discount for certain pieces of equipment such as laptops, desktops, and tablets. And at this point, there are over 1,800 service providers in the program and over 20 million households enrolled in the program. We actually hit that mark just last month in August. So for more information on the program or to apply, you can go to getinternet.gov, or in Spanish, for a Spanish language application, you can go to accedealinternet.gov. Couple of other recent changes to the program. Just last month, the commission adopted rules that would provide a $75 per month discount for households that are in certain high cost areas upon a showing of particularized economic hardship. And in addition, the commission just reached an agreement with HUD to promote the ACP program. So that's very brief overview of many of the things that we are doing here at the commission to promote telehealth. And now I will turn it back to, I will turn it over to Mark Colon from NTIA to share what NTIA has been up to.
Thank you. Thank you so much, Brian. And my name is Mark Colon, and I am the Director of Public Engagement here at National Telecommunications and Information Administration, which is a mouthful, here at the Department of Commerce. And what I'd like to do is just as a political appointee, I just wanted to pull back for a moment and provide a bit of the big picture context on the administration's approach to providing high-speed internet access, which we call, you may have guessed already, internet for all. So if we could turn to the next slide, please. So the bipartisan infrastructure law is a once-in-a-generation investment in our nation's infrastructure and economic competitiveness. In addition to investing nearly $1.2 trillion in traditional infrastructure investments like roads, bridges, tunnels, and airports, the law allocates $65 billion for high-speed internet efforts through 7 federal programs, which we're calling Internet for All. I want to step back for a moment and put this in context, though, right? We've all heard the president say this is a transformational moment for our nation, right? Not only are we addressing, this law address long overdue tangible infrastructure needs, but since the pandemic, we've come to realize that high-speed internet access, as Commissioner Carr mentioned at the top here, is no longer a luxury. It's a utility like electricity and clean running water. So the goal of internet for all and the promise that President Biden has made is to ensure that everyone in America has access to affordable, reliable, high-speed internet service by 2030, and that we once and for all close the nation's digital divide, right? Not too much pressure, but we also know that closing the nation's digital divide doesn't stop with just providing access. We need to develop the resources to equitably expand the adoption and use of the internet, and that's what these programs go to. So if we could turn to the next page, please. My fellow panelist agencies, as Brian mentioned, are administering 2 important IFA programs. The ACP program that Brian described, as well as the rural internet program. NTIA is administering 4 significant Internet for All programs, which include nearly $3 billion for digital equity programs, $2 billion for tribal connectivity, and $1 billion for enabling middle mile broadband infrastructure. Could we turn to the next page, please? Thanks. But today I wanted to focus on the largest of those programs, the Broadband Equity Access and Deployment, or BEAD program. The objective of BEAD and the primary purpose is to fulfill the president's promise I mentioned of providing affordable, reliable, high-speed internet service to everyone in America, every residence and business, or what we're calling every broadband serviceable location in America by 2030. Important thing to remember, a few important points, is that the BEAD funds will be administered by the states and eligible territories. I am happy to report that all 56 eligible states and territories have opted in to the two largest, and those two opt-in programs, BEAD and Digital Equity, and that every state and including Puerto Rico and Washington, D.C., received at least $100 million BEAD allocation, and then pursuant to a formula based on the FCC's new maps, President Biden announced in June BEAD allocations for every state and territory of between 180 million up to 3.1 billion. That allocation went to Texas, but there were many other states that received over $1 billion in BEAD allocations to fulfill those objectives. And that's where we're talking about transformational moments. You can find your state's allocation of BEAD at our website, internetforall.gov. I'll have a slide at the end that has some resources, some links to resources where you can find information. And also, we are very keen on this being a whole of America approach to closing the digital divide. We know that there's not just one size that fits all communities or all industries, so that it's an extremely participatory program, which we'll talk about. And so we've set up some of these resources that I will go over, and if possible, my colleague Viola Nizigama will be posting some of those resources in the chat. If we could turn to the next page, please. Okay. BEAD prioritizes, the first priority is connecting all currently unserved and underserved locations in America. And as I mentioned before, for the first time, we have maps that the FCC has developed that shows access to broadband down to the building level. And for this group, it's important to note that the third priority of the BEAD program is that community anchor institutions like schools, libraries, hospitals, and healthcare centers are at the very top of the list that states have to consider in allocating their BEAD fund. But many states and territories will have BEAD funds left over after fulfilling their primary objective to connect everyone, right? Some states have large unserved areas, and all of their BEAD funding will go to that primary purpose. But many states have upwards of 95% coverage already. And there are a wide variety of uses of BEAD funds for digital literacy, training, devices, and other technical needs. If we could turn to the next page, please. And stakeholder engagement is an extremely important part of this process. NTIA has hired a federal program officer in every state and territory to act as an intermediary between communities, key stakeholder organizations, and the state's broadband offices that will be administering these funds. Many of those broadband offices are they're involved in putting together their plans, we're calling them the BEAD initial plans. Those plans require robust stakeholder engagement. They have to show us that they've engaged with key stakeholder organizations as well as municipalities, and that their plan is informed by that, by those, any comments that may have been made. Every state has to post their initial plan before they turn it into us for public comment period. We have a website at both Internet for All and at our broadband page, where we are posting in real time each state and territory's plan as they post it for public comment. So this is a critical opportunity for healthcare organizations and other institutions that deal with people and know what people's problems are and how they can best be solved at the local level to provide input to their state plans. You can also log on to our website to find a map of all 56 states and territories. And if you click through that map, you can find contact information for that state's broadband office, as well as NTIA's federal program officers that I mentioned, and info about the various broadband funding programs other than BEAD and the IFA programs that are available in your state. And if you could turn the page, please, to the next page. This is the resources page that I mentioned. As I mentioned, the states currently, some of the states have already posted their initial plans for public comment. That's fine. You still have an opportunity. Those plans are going to be posted in volumes 1 and 2. We still have volume 2 to be posted, as well as 5-year action plans that they're required to put together to describe how they're going to use all of their funding related to broadband to close the digital divide. There's also digital equity plans. So there are plenty of opportunities to get involved. I encourage you to get involved. This is, as I mentioned at the top, Congress is not going to be allocating $1.2 trillion or anything near that anytime in the near future. We're here to try to get this right, working closely with our sister agencies. And with that, I will turn it over to the next panelist.
Thanks, Mark. Thanks for having me today on the panel. As Brendan said, my name is Kelly Kabita. I serve as USDA's Rural Health Liaison, and I'm excited to be with you today. And I'm hoping we get my slides up in a second. There we go. You can go ahead and skip to the next one, please. So what do you think of when you think of USDA? You might think of prime beef or national forests or funding for farms. We are a very large department, and we have 8 mission areas. Those are laid out here on this chart, and each of them have functions that can support rural health through things like education, social determinants of health, food programs, and what we do in rural development. That's the green box over there to the right. That's where I sit within the department. We fund infrastructure. Rural development is the only federal agency that focuses exclusively on rural communities, and we essentially function as kind of a world bank for rural America. We largely operate through our 47 state offices, where our employees live and work in the communities that we serve. Next slide, please. So you might be wondering, what in the world is a rural health liaison? And that's a very good question. Congress created the role in the last Farm Bill in 2018 and laid out 9 responsibilities that really boil down to coordinating and collaborating across USDA, also with the U.S. Department of Health and Human Services, and with others to promote rural health and share information and data about USDA programs, but also about rural health. Been in the job about 18 months. I sit in the rural development mission area, as I said, but I also work across the department. Over the course of my tenure as the rural health liaison, I've been working on building relationships and networks related to USDA's support of rural health, including telehealth, and to advocate for rural communities with other partners. As part of that effort, we've created an internal website which is for USDA employees that shares information across the mission areas, but also as an inventory of USDA programs and products related to rural health. It is my hope that over the course of the next year, we can flip that inventory around so that anyone in the public can see that. In the meantime, if you want to reach out to your local state office, the staff there have access to the inventory, and there's a lovely little print button up in the corner so they can share that information with you as well. I've also worked with other parts of USDA and HHS to support a lot of conferences and webinars, other ways to communicate about rural health, including a couple that I've highlighted here in some links related to rural mental health. So next slide, please. So as I mentioned, rural development is a big bank for rural America. We actually serve as the 12th largest bank in the US. We provide loans, grants, and loan guarantees for all kinds of capital expenses related to rural infrastructure, including broadband infrastructure and telehealth equipment. We have more than 70 programs that can fund almost any kind of capital investment in rural communities. We generally don't have programs that can support operational costs of the kinds of projects we fund. While only a couple of our programs have something related to health or medicine in their title, actually a lot of our programs can support projects related to telehealth. Next slide, please. This is just a graphic to kind of give you an example of how our funding is divided up. It's a little bit dated, but we have between 2000 and 2019, more than $400 billion was invested in rural community development, largely in infrastructure. You'll see that big green box is mostly related to single family housing. We give a lot of direct and guaranteed mortgages to qualified families across rural America to get into homes. That little orange box in the corner on the lower right is the $10 billion that we had invested in telecom over that time. That does not include our Reconnect program, which is a relatively new program, and I'll talk more about that in a minute. It's been a big investment in broadband over the last few years. We also fund rural businesses, essential community facilities, water and electric infrastructure. Next slide, please. Something new that we've done in just the last couple of years is aligning the priorities across all of RD. RD being short for rural development. Typically, some of our programs allow for prioritizing certain areas of emphasis beyond our typical eligibility and need evaluation. We now align around a single set of priorities for all of our programs with standardized methods to demonstrate that you're meeting those priorities. So you can find out more at the link in the slide once you get those when we're done today. What I think is great about that demonstration of meeting the priority is that it's based on data. It's not based on how persuasive you can be with your writing. What we find is a lot of rural communities may or may not be able to afford to have a consultant that can help them with their application and can help them pull information together. So what we try to do with these priorities is make it pretty easy for folks to be able to just come and use the information on the site and say, hey, this is my project, this is where we're going to be funding, and be able to demonstrate that they're meeting those priorities by just using the data there on the site. The priorities include climate change, equity, and expanding markets. Next slide, please. This slide gives you some important information around some of our broadband infrastructure programs. As I mentioned before, our biggest program is Reconnect. It's a relatively new program that's really focused on expanding commercial rural broadband across the country in rural areas. Another program I want to highlight is our Community Connect program. This is a smaller grant program that's focused on communities that really do not have any broadband. In those communities, an entity could be a government, could be a community organization, could be a business that wants to come in and apply for a grant to be able to bring in the infrastructure to expand broadband into that community. They have to support access to that broadband at the community level, usually with a community center with some computers and equipment hooked up in there that anyone in the community can use. The idea behind this program was really trying to drive commercial investment by paying for bringing broadband into a community and then hoping that there would be an opportunity for commercial providers to invest based on that infrastructure being brought in. One of the things we're trying to do in the Rural Development Innovation Center where I work is actually determine whether or not we've met that policy goal. So we're actually looking at older grant programs or older grants that we've done under the program and trying to see did commercial broadband come into those communities after the conclusion of the grant. So stay tuned for that. Next slide, please. I also want to highlight our distance learning and telemedicine grant program. This is a really unique program for us where we support equipment purchases or upgrades or facility upgrades related to distance learning and telemedicine. With this program, we've had a lot of great projects that not only provide access to healthcare via telemedicine, but also bring important training into rural communities that can relate to healthcare or social services. So for example, we've had some projects where nursing students in a community where there's not a place where they can go and study nursing are able to do it via remote learning, along with bringing in healthcare to areas that don't necessarily have those providers locally. In the last Farm Bill, Congress also designated a 20% set aside for this program for projects that support substance use treatment projects. Next slide, please. Also want to highlight our community facilities program. This is a program that's largely loans and loan guarantees to develop and improve essential community facilities. The applicants do have to be public bodies, local governments, things like that, Native American tribes, or nonprofits. We fund a significant portion of our healthcare related projects in rural development through this program, including those that support telehealth. Some of the same items that can be funded under our distance learning and telemedicine program can also be funded under our community facilities program. Grant dollars are limited in this program and usually are reserved for smaller equipment purchases versus larger infrastructure projects. In FY23 so far, though, we've already invested more than $750 million in the community facilities program, including more than $360 million in healthcare and social assistance projects. Next slide, please. I also wanted to highlight a technical assistance program that we have with the National Rural Health Association. If you guys tuned into the panel before this, you saw Ellen Morgan from NRHA. They work really closely with us to assist selected rural hospitals. So those usually are nominated by our state offices. So they're hospitals we're already working with, and they need some extra assistance to improve their operational and financial health. This technical assistance can include assessing service lines and delivery, including telehealth, and ensuring a robust revenue cycle, including proper billing under the various insurance providers that the hospital works with. In FY23, RD invested more than $3 billion in technical assistance, both for the regular appropriations and also through technical assistance dollars identified in the American Rescue Plan. Next slide, please. We also have a lot of programs that support rural businesses, including private healthcare entities. That funding is in the form of loans, grants, and loan guarantees. The funds, again, are largely oriented to capital costs, purchasing or constructing infrastructure. A couple of specific programs I'm going to highlight in a minute are our Business and Industry Loan Guarantee Program and the Rural Economic Development Loan and Grant Program. We also have a variety of technical assistance programs that can support rural businesses, again, including private healthcare entities. Next slide, please. Under the Business and Industry Program, lenders are the applicants to our loan guarantee program. So they bring fully formed loan deals that they've been working on with private entities in the community, and then we work with them to guarantee that loan so that they can give the best terms to rural businesses so it's affordable. Next slide, please. In the case of the Rural Economic Development Loan and Grant Program, or REDLEG, as we like to call it, that is a unique program where utilities can actually come and get loans, low interest loans for rural development, and relend that money in their communities to support projects that create or sustain jobs, including healthcare projects. These are usually a little smaller on the loan and grant side, but have been really useful in the healthcare scenarios. Next slide, please. Beyond the funding programs that we have, I wanted to mention a couple of other initiatives, including the Rural Data Gateway. This is a new information source for rural development that really visualizes the USDA investments in rural community infrastructure. You can look at the programs that we have. You can look at certain fiscal years. You can look at county level data. It's really a great source of information if you want to see where rural development has been investing in your community. Next slide, please. We also have a new initiative called Creating Opportunities Through Rural Engagement. I'm really excited about this one. I think it's a really innovative program because our performance measurements are about our connections with rural communities rather than the number or amounts of loans or grants that we're making. The initiative really identifies eligible communities where RD hasn't engaged in recent years, but also those communities have great need. Our state offices then reach out to better understand the needs of those communities, the barriers they may be facing in accessing rural development programs, and how our policies and programs could be modified to better meet their needs and improve rural community prosperity. Since the project began, rural development has engaged almost 500 communities, and we've also invested more than $260 million. Next slide, please. Lastly, but certainly not least, is our major federal government-wide initiative, the Rural Partners Network. Rural development has hired and placed federal staff in 36 communities across 10 states and Puerto Rico. to help navigate federal resources, leverage partnerships, and build long-term capacity in those communities. The initiative has more than 20 federal agencies involved, including Health and Human Services, who have identified specific staff as rural desk officers that can assist the communities. We hope to learn more in these communities that can be shared broadly to assist rural communities across the country. And last slide, please. I know this was a super quick overview of a big agency with a lot of programs. I've got a lot of links within the slides, but also here on this one and contact information. So if you want to find out details about any of our programs or initiatives you've heard about today, thank you for your time and attention, and I'll turn it back over to Brendan.
Hi, this is Heather Damaris. I think we might have a mic issue with Commissioner Carr. So I will just take a minute and fill in. Thank you all for the remarks that you provided. I know there was a ton of information that's helpful for our audience that was prepared in the slides, and so many funding opportunities around improving access to broadband. So I will take a moment and just double check. Commissioner Carr, is your mic working yet? Okay. Well, we will pop over to do some Q&A, and I am jumping right in. So apologies for not being incredibly prepared, but I would like to just pull up a question that came in from the audience and highlight that. And what we'll do here is just if someone has a response, go ahead and chime in, or we can go round robin as well. So how has this one is directed for Brian, actually, how has the FCC prioritized satellite versus fiber for broadband connectivity?
So we want folks to be connected. How they connect is not nearly as important to us as the fact that they connect. So for purposes of telehealth, if you have a fiber connection, that's great with us. If you have a satellite connection, that's fine as well. Oftentimes, particularly in the very remote areas that the rural healthcare telecom program serves, satellite might be the only option, and that is supported in the telecom program. I'm sure many people in the audience are aware that there are some very exciting advances in satellite technology, particularly with low Earth orbit satellites. That will certainly be a part of the solution for connecting healthcare providers in future years. So the bottom line is our job is to connect folks. We do not have a particular preference as to whether it is fiber or satellite, although certainly there are benefits and drawbacks to both technologies.
Thank you so much for providing that perspective. And I forgot to introduce myself for those who weren't on earlier sessions. My name is Heather Damaris. I'm the director for the Office for the Advancement of Telehealth at the Health Resources and Services Administration. And we are putting together this conference. Now I'll do another quick check. Commissioner Carr, are you having any luck with your mic? We would love to have you moderate this, but completely understand technology issues.
I think I'm back. Can you hear me now?
I can. Okay.
Yeah. It's
wonderful.
It's always great on a panel on connectivity when there's a technical problem on the FCC guys. But thanks so much, everyone. I know there's a lot of questions as well in the chat that I was tracking, and a ton of information. Obviously, one question people had was whether we could make some of those slides public, and we'll sort of get into that, or maybe see if the panelists want to speak to that at all. The other questions, as was talking about was, fiber versus satellite, as was indicated, we really try to sort of do a blend of sort of a neutral approach from a technology perspective to get everything out there. There was a question as well about, the benefits of telehealth, and I put one answer to that in the chat, and some of that was gotten into by some of the panelists as well. There's questions as well about what we're doing for the territories, what we're doing about Puerto Rico, and a lot of the FCC's funding initiatives do, in fact, cover all of those areas as well. We have, again, low-income programs that cover every area, and sort of actual infrastructure programs that cover everywhere. There's also questions, and, again, I'll turn back to the panelists here soon, on licensing and reimbursement issues. Obviously not an FCC issue, but it is a huge impediment because you can be in one state able to visit a patient in another state remotely over video, but there's some issues there with licensing and reimbursement. So that certainly is an issue that we run into a lot. One question that we've had prepared that I'll kick around real quick is, as we look at sort of struggles to get even, cell phone service, let alone broadband service in some areas. Maybe some of the panelists talking a little bit more about the efforts underway to bridge the digital divide. I know we did it in some detail, but maybe, touch again on a high level of all the different efforts that are underway on that front. Now, Brian, you want to start, or if you want to sort of start somewhere else?
Sure. I'm happy to start. I mean, that is, as Commissioner Carr, that is one of the primary goals of the Federal Communications Commission. Connectivity doesn't come without infrastructure. So while, I was certainly describing telehealth specific programs that offer subsidies for specifically for telehealth, we do have infrastructure, quite a few infrastructure programs here at the FCC. For example, we have several high cost programs that offer support for build out because you can't have oftentimes that connection without build out. And I know we had certainly heard from Mark over at NTIA about what NTIA is doing to promote infrastructure, and heard from Kelly. I don't know if you all have anything to add on anything additional that your agencies are doing.
I'd just say I spoke a lot about the infrastructure, our deployment efforts before, and the priority being unserved and underserved individual locations the states are putting together, are using the FCC's maps to put together proposals for reaching every one of those locations. And as I mentioned, there'll be a challenge process to those. Every state will have a challenge process, and people can use other sources of evidence at that point besides the FCC maps to show that while the state may have passed over their location, it actually needs broadband service. So, but the other thing I wanted to mention was there's a question about plans for education to elderly and those with special needs or disabilities. Under the Digital Equity Act, there are 7 covered populations, and these are populations that have historically had not been represented in high-speed internet service, or have particular needs. These go beyond the typical types of demographics we think of when we think of equity programs. They include senior citizens, they include veterans, they include communities of color, they include low-income locations, and so think very broadly about any population that may have historically had lower rates of adoption or lower rates of access to the internet. These are the populations that we're going to be prioritizing in making sure that we get service and also training and education to people.
Yeah, and again, I think we're sort of tackling this issue at multiple levels right now. Again, we've got affordability issues that we're focused on. Again, the FCC has this sort of unprecedented program, ACP, American Connectivity Program. I'd encourage people to Google it, or Bing it even, I don't know, and look at the FCC website and get more information on that. It's really groundbreaking in terms of availability of connections for low income. We're tackling it on the internet build itself. Again, in parts of the country that have nothing, we've got this ongoing $9 billion a year program at the FCC, in addition to obviously the influx of funding from the Infrastructure Act. And as our friends at NTI laid out, there's a whole timeline and process right now where that's going to take place. And of course, coordination, making sure all of us that have a little piece of broadband, a little piece of internet, a little piece of telehealth are talking together. And events like this, frankly, are helpful. I don't know if there's someone on our panel that wants to speak a little bit about some of the coordination issues across government efforts, either from your own perspective or just sort of more broadly. I don't know, from the USDA perspective, if you want to talk a bit about, sort of coordination across agencies right now.
Sure. I think We coordinate at all kinds of levels. So certainly there are a lot of broadband oriented coordinating groups around the infrastructure side. So, with the FCC, with the TIA, with a number of different agencies. On the healthcare side, also, we have our MOU between FCC, USDA, and HHS specifically oriented towards telehealth, where we're sharing information and working together on some broadband pilot work that the HHS folks have been spearheading. So really a lot of opportunities to coordinate there as well. I did want to mention a couple of things that I had so many things in my presentation I didn't throw in before. We really are focused on infrastructure at all levels. So we have our broadband programs that's looking at commercial infrastructure expansion or community level expansion. We also have some other authorities within RD where, for example, our electric program can support smart grid adaptation. So you want to bring more kind of smart controls to your electrical grid management. And then we also have what we call our smart utility program, which was something in the last Farm Bill that allowed for a small percentage of any project authorized under the Farm Bill to actually incorporate some broadband costs into that project as well. So you could be building a hospital and need to bring in some infrastructure related to access to telehealth. And you could potentially use that smart utility authority as a way to build that into your project, as opposed to having to apply to a different grant program or a different loan program to be able to fund that piece of your project. So there's a couple of flexibilities there that we're excited that we have. And one of the great things about rural development is we talk a lot about being able to build a community from the ground up. We have all kinds of programs that can do a lot of different things, and we're excited to work with our partners.
Yeah, I think there's no doubt that coordination is a challenge. As broadband and high-speed connection has become more important to so many different sectors of the economy, as we talk about agriculture, not just telehealth, but just generally for agriculture, we get more and more sort of initiatives and programs. And I think we're heading in the right direction, but there's still more to do on the federal coordination point. It was noted in the Q&A, there was a report that said we basically have over 100 different programs right now that are sort of designed to fund broadband. In some ways, that's good. It shows the interest in it. It shows the desire. We do need to continue to sort of hone in on coordinating across the agencies, but we're getting some MOUs in place. I think we're moving in the right direction. Again, I think we do have a pretty unique opportunity right now with the funding to effectively end the digital divide. So we're making progress. We're not putting the mission accomplished flag right now, but I'm pleased with the results we're seeing. There was a question, we talked a bit about it in terms of results with telehealth, and that's not necessarily the focus per se of this panel. I know, Brian, you mentioned some examples with Faith Regional, I believe it was Access Richmond in Texas. I don't know if someone else wanted to sort of weigh in with some of the data that they're seeing in terms of the benefits of telehealth.
I'd just say, not on the front end of that question, Brendan. I know we do a lot of work with the National Health IT Collaborative for the Underserved and the Telehealth Equity Coalition. And a couple of years ago, they put out a white paper on determinants of health, social determinants of health, and broadband. They ended up titling the paper broadband as a super determinant of health, since even relative to all the other things that we might think about, income and the like. So access to broadband is actually a super determinant of health. One of the reasons why this administration and every agency and the administration that touches upon this is really a priority. So
yeah. Well, thanks for that. We're sort of nearing the end. There was another question in there, particularly about what are we doing specifically for school kids, and there is, in fact, an initiative underway called ECF at the FCC that, again, is sort of a specific statutory program designed to make sure we have affordable connectivity for school kids. So again, we have sort of a school kid specific initiative. We've got a broader sort of low income initiative, and so we're really sort of trying to tackle at least the two key features of the digital divide, which is the availability of the infrastructure itself and the affordability of it. And of course, there's more to it as well that we're working on. We talked about some of that, digital literacy, relevancy, helping to drive some of that as well. And we're funding some grant programs to try to help with some of the outreach there. Brian, I don't know if you were positioned or wanted to chat a little bit about some of the digital literacy or digital relevancy as we sort of enter the last couple of minutes here.
Sure. We have, one of the reasons we launched the Connected Care Pilot Program was to learn what else we need to do besides providing those connections. Because if you have the connection, that's great, but you do need to access those connections. And one of the things that we have learned thus far is that there are particular challenges for some particular populations connecting. Specifically, we've learned that senior citizens and people who have English as a second language have particular struggles connecting to the internet. In order to take advantage of some of those programs, those folks need a little bit of extra help. I know that, Kelly mentioned technical assistance for hospitals, their facilities, but that's something we're looking at right now. What role, if any, federal government for helping individuals connect for purposes of telehealth, and then potentially what role healthcare providers can play in that as well.
Yeah. Well, thanks so much. I think we've done it once again. We should probably wrap up at this point. And again, I think sort of a quick summary obviously is, if you are dealing with trying to expand telehealth and someone is low income, we do have a lot of initiatives that are designed to sort of address that. Right now, we've got obviously a program that includes smartphones, handsets. We've got the monthly connectivity funding. We have programs specifically designed for school kids as well that still has some funding remaining in it. More broadly, if the access itself doesn't exist, we're working on that. That's a longer term project, but we are making a lot of down payments on that, both as a policy matter and as a funding matter, so that we get to the point, hopefully, in the not too distant future, where there isn't an issue with affordability and there isn't an issue with access to connectivity. So we're really prioritizing this at the federal level, working with our state partners. So again, I want to thank everybody. We'll take a look and see whether we can get some of this information posted. But in the meantime, there's a lot on the FCC's website, a lot on USDA's website, and a lot on NTI's website. So I want to thank everyone again. We're going to take a break for lunch. So please come back at 12:45 p.m. Eastern, and we'll continue with the conference at that time. And we'll have additional sessions on telehealth, on workforce, on telebehavioral health, and also on telehealth research trends. So a lot of really, really good information to come and interesting panels. So thank you again for joining us for this one. Thanks to the panelists. I really enjoyed it. Thanks.